welcome to the University of Utah team of hypertrophic cardiomyopathy. We're here today to celebrate this amazing day to try to increase awareness and really help you and others learn more about hypertrophic cardiomyopathy. At the University of Utah, we have a great team of folks, and this is a disease that really lends itself to a great team. And I want to introduce our team to you and share some stuff about the University of Utah that we think might be valuable to you. So my name is Craig Selzman. I'm one of the cardiothoracic surgeons here, and I couldn't do any of this. I don't do anything. This team next to me does it all, and it's led by one of our cardiologists here, Omar. And so Omar, why don't you tell a little bit about yourself and when you came and the program that you started.
I'm Dr. Omar Weaver Pinzon. I'm the medical director of the hypertrophic cardiomyopathy program here at the University of Utah. I joined this team in 2015. We built this program as a multidisciplinary team with the main goal of fulfill the needs, diagnostic and treatment needs of our HCM communities, not only in the state of Utah, but also in the surrounding states. This program has grown over the years tremendously. From 2015, we had about 25 active patients, and we have grown to a volume of about 400 active patients nowadays. We take care of this population in different disciplines. In 2019, we became a center of excellence, and we are very appreciative of the support of the HCMA, or the Hypertrophic Cardiomyopathy Association. None of this success and this great experience that we have had over the years would have been possible with my right hand, who is our HCM physician assistant, which gonna talk to you.
Hi, I'm Holly Andrews. I'm a physician assistant working with our hypertrophic cardiomyopathy clinic. Dr. Weaver Pinzon asked me to join the clinic in 2018. And it's been an incredible experience since then. Our patients, again, come from all over: Montana, Colorado, Arizona, Nevada, Wyoming, and Idaho. So we see a large number of people from the surrounding areas. We do telemedicine, in-person visits. In clinic, the purpose of having both our physician and a physician assistant is being able to maximize the amount of people that we can see and dates that we see. Typically, our hypertrophic cardiomyopathy clinic is reserved for Thursdays, but that doesn't work for patients all the time. So I'm in clinic 5 days a week, 90% of the time, and we're able to fit patients in for any of those other days. One of the reasons why I actually went into medicine is for the teaching opportunities. And that's one of the incredible things that we do in our clinic, is we are able to spend a lot of time teaching about this disease, because it doesn't just affect our patient, just the patient. It affects their family members and their children, their parents, their siblings. And so when we find somebody with hypertrophic cardiomyopathy, we have to involve care for the entire family. And that takes a lot of time to talk about the ins and outs and what we need to do for this. So I love that our clinic offers that ability to see them any day of the week and to be able to spend that time with our education as well. To do that, we have to coordinate quite a few things. So there's a lot of testing that has to go on for these patients. And so we have our program director, Nicole Segura, who's going to talk a little bit about that.
Hi, I'm Nicole. The best part of my job is that I'm able to meet our patients from the time that we get their first referral to getting them into clinic. We make sure that we get all their records set up so that we're able to maximize their time efficiently and coordinate all of their appointments for same day, because a lot of our patients are coming from out of state. We're able to help with housing if they need while they're here, and I love just being able to get to know our patients and make sure that they're taken care of.
Building this program has created a huge impact here at the cardiovascular medicine division of our university. With our program, we actually hired our first genetic counselor, which and from there we have created our genetic program, and which has had a tremendous impact in our clinical care, also in the research field. When we talk about medical therapies in HCM, we know that the medical management of HCM hasn't changed significantly over the years, but in the last decade, we have seen a number of therapies that have come out and are being tested in clinical trials For instance, the group of myosin inhibitors and other agents that affect metabolism and other targets that involve genetics as well. And we are part of those trials, and we're happy to be part of those trials because we know that creates an impact in the community, in the HCM community. Some of the trials that we have participated involve testing the safety of exercise in patients with hypertrophic cardiomyopathy and other genetic conditions, such as long QT syndrome. We have also been involved in phase 2 and phase 3 trials, testing medical options, specifically trials of myosin inhibitors, mavacamten in the use of patients with obstructive hypertrophic cardiomyopathy, and also in the population of the non-obstructive cardiomyopathy patients.
We also have 2 upcoming clinical trials. We actually have one for obstructive patients that's going to be starting in March, and then we think we have one for non-obstructive patients starting hopefully April. That timeline may change just a little, but the exciting part is they're upcoming soon this year, which we're very excited about for our patients.
The interesting thing is how much you guys hate surgery, you know, and part of it is because the medicines have become so good. But there are a group of patients that really do benefit from more interventional approaches, including things like septal ablation, alcohol septal ablation, as well as more traditional surgeries. I did my first myectomy a little over 20 years ago, and a lot has changed in the way that we approach surgical disease. We're starting to see a lot of patients coming back with recurrence of disease, and also really starting to recognize that the mitral valve is a really important part of this process. Patients that have the HOCM, the obstructive cardiomyopathy, and trying to deal with these has enabled us to utilize alternative approaches, including transcatheter approaches to deal with outflow obstruction associated with the mitral valve. And so it's a real comprehensive approach. And some of these patients, unfortunately, because of the hypertrophic cardiomyopathy, generalized hypertrophic cardiomyopathy, actually need to have transplantation. So we are pretty fortunate here at the University of Utah to be part of a more global group, not just within hypertrophic cardiomyopathy, but a number of other cardiomyopathies and advanced heart failure, such that whether or not we might need to use mechanical support or move to transplantation is a relatively smooth process for all of us here.
When our patients are referred to us for hypertrophic cardiomyopathy to start with, most of our patients, they tell us there's a lot of anxiety going forward with it because they've Googled everything they can on the internet and they're not quite sure what to expect. So again, a lot of what we do in clinic is starting to educate about what this disease is, what it means for them in their lifespan, what it means for their family members. And then once we have that baseline knowledge, we're able to then ask them to go to their family and ask them to talk about their medical history, so that way they can create awareness in their own homes and their own families. Now, the broader part, I think, is where we are starting to work on things more. This Hypertrophic Cardiomyopathy Awareness Day, the first one ever, that's going to be on Wednesday, February 23rd, I think is an incredible thing to be able to get more of this out into the community. Here, we talk a lot about hypertrophic cardiomyopathy and treatments and surgical procedures among other healthcare professionals. We give talks out in the community in different areas, and we personally are going to try and work on how we can get it out into the non-medical community, so to every person. And what we're doing with this is trying to do this video. We're going to be working more with our social media pages so that we can start spreading this word more. So it's not just coming from our patients, it's not just coming from physicians, it's going to be coming from the community as a whole as they recognize what this disease process is.
Our efforts are being focused on promoting HCM within our institution and also other institutions with different providers. But here's where the Hypertrophic Cardiomyopathy Association plays a key role, because we also reach to our community through activities and symposiums that are organized by the HCMA.
Well, we hope you learned something out of this last few minutes with us here. And just remember, next time you come to Utah and you're going for a ski and you pass out, we're here at the University of Utah.